Hello and welcome to this National MS Education and Awareness Month conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Chris Hudspeth. I'm the radio program manager for MS Focus, and I'm joined today by Dr. Ben Thrower from the Shepherd Center in Atlanta and Aryn Seiber from the Cannabis Foundation. And today we're going to be speaking about cannabis, specifically the best practices for intake, as well as some innovations and what to avoid to stay safe if you use cannabis as medicine for MS. After the presentation, we're going to do a Q&A, and we'll open it up to your questions and comments. Get them ready to go. Now, I'm delighted to introduce our speakers. Dr. Ben Thrower is a medical director of the Andrew C. Carlos Center MS Institute at the Shepherd Center in Atlanta, Georgia, and senior medical advisor for MS Focus. And Mr. Aryn Seiber is a 9/11 first responder and stage 4 cancer survivor. He has more than 40 years of plant experience and launched the Cannabis Foundation to help educate others and pay it forward. We're pleased to have him join us today to present this very important topic. And thank you guys for being here as well. And Dr. Ben, I'll turn it over to you.
Absolutely. Thank you, Chris. And thank you to everyone else at MS Focus. We really appreciate you folks as always. And thank you to all of our participants at home who are joining in. And thank you, Aryn, for joining us as well. In a bit, I'll give a little bit of backstory about Aryn and I's relationship and how we've worked together in helping serve the MS community. So what we'd like to do is I'm going to do just a few minutes of just kind of an overview of cannabis, cannabinoids, how these relate to multiple sclerosis, where the science is at, where the clinical uses are, and kind of how we think about things. Then I'll turn it over to Aryn, and then like Chris said, we'll leave plenty of time for questions and answers. I think Chris made a really important statement in his intro. He said, thinking about cannabis as medication. And that's really what we want to wrap our heads around today. Certainly, people use cannabis recreationally, and we're not here to encourage or discourage that. We're here to talk about cannabis as medications. And so when we say cannabis, we mean the kind of the broad spectrum of plants that includes what we would traditionally think of as marijuana, weed, pot, whatever you want to call it, and then the hemp subspecies. It's all cannabis. It's all in the same group. And so sometimes people get very hung up when we're thinking about marijuana cannabis on names like sativa and indica. And traditionally, when we've talked about those two sort of species of cannabis, sativa was usually felt to be maybe the more sort of invigorating sort of feeling, whereas indica was maybe a little bit more sedating. What we'd like to do in the medical world is maybe move past that and have people, again, think of cannabis as medications. Think about it in terms of milligrams. When you take a medication for your MS, as much as the drug companies would like you to get hung up on their fancy name, it's not the name that matters. It's the mechanism of action. It's the safety profile. It's the data behind that name. Think of cannabis in the same way. Think of it as a medication. So when we think about the active ingredients in cannabis, you can think of a class of chemicals called cannabinoids. Cannabinoids, there are over 60 cannabinoids in cannabis, and it's what's in an individual plant is going to vary by species and hybrids and whatnot. The two cannabinoids that we are usually most interested in are going to be CBD and THC, and we'll talk more about those as well. There's another chemical class in cannabis plants, and those are the terpenes. We're really just starting to scrape the surface of the biologic effects of terpenes and the possible benefits of that class of chemicals, but those may be important as well. What's interesting is the human body has an endocannabinoid system. So we have chemical receptors in our body for cannabinoids. Well, why would we have those? Did we evolve specifically to react to the phytocannabinoids in these plants? Well, it turns out we have our own endogenous cannabinoids or endocannabinoids. These are chemicals that look very similar to the cannabinoids in cannabis and have some of the same mechanisms, same actions. And what we know is that there are two main endocannabinoid receptors. These are the chemical receptors where cannabinoids are going to act at. There's a CB1 receptor, which is primarily present in the central nervous system. Different areas of the brain and spinal cord have different concentrations of these CB1 receptors. And then there are CB2 receptors. These are receptors that are primarily present on cells in the immune system. These appear to have primarily anti-inflammatory effects. How cannabinoids work in the central nervous system is incredibly complex. Different areas of the brain, again, have different concentrations of these CB1 receptors, different doses of different cannabinoids, let's say THC, for instance, can have one effect in one area of the brain and a completely different effect in the other area of the brain. So this is where the science is still evolving when we think about the ratios of different cannabinoids and how we take them. Cannabinoids can be administered as an edible or oral form. They can be administered in an inhaled form. There are topical forms of cannabinoids that might have use for different conditions. So what do we know about cannabinoids and multiple sclerosis? Where the most of the science has been in looking at symptom management for cannabinoids. So, and there are three areas where there's pretty good data saying cannabinoids could be of benefit. One of the probably the longest and best studied area would be in spasticity and spasm management. So increased muscle tone in multiple sclerosis, resulting in painful, uncomfortable spasms. There's pretty good data to show that the cannabinoids do have an effect there. So we think about, again, cannabinoids in the management of spasticity and spasms. Central neuropathic pain. This is burning, hypersensitivity, sometimes called dysesthesias. We can, there's data looking at cannabinoids being used in central neuropathic pain. And then lastly, an area that has been probably more recently studied, but there's pretty good data in, would be bladder symptoms. So a small overactive bladder, having bladder spasms, there is data out there showing that cannabinoids can be of benefit there as well. So whenever we think of medications, if you're talking to your healthcare provider, you're going to talk about the benefits of a given medication. Well, we always have to balance that out with the risk or the side effects of a given medication. And if we're going to think of cannabis as a medication, we need to be honest and say that there could be potential side effects as well. Some of the side effects that we see with cannabinoids are pretty well known. Things like potential drowsiness, or maybe you get high from it. If you're trying to treat a symptom with your MS, ideally we'd like to make you functional, have symptom control without seeing potentially the psychological effects of the cannabinoids. People can have time distortion where time seems to slow down for them. There can be impairments of motor function if we get too much on board. Interestingly, we sometimes we think of cannabinoids as decreasing nausea, and that's certainly true for most cannabinoids. But if you get too much or you use too high of doses chronically, there is actually a paradoxical hyperemesis or extreme nausea and vomiting syndrome. It's actually called a cannabinoid hyperemesis syndrome. This is not fun for people. This will send you to the emergency room if you have it. This occurs usually in one of two settings. This usually occurs in people who are using very high doses of cannabinoids on a regular basis, and they just need to back off on their dosing. Or it can also occur in a naive user, someone who's really never had experience or exposure to a cannabinoid, and they get a big old dose all at once. It's protracted nausea and vomiting. Unfortunately, it doesn't seem to respond especially well to our usual anti-nausea medicines, things like Phenergan and Zofran. Usually in the emergency room, they're going to hydrate you, put an IV in, and just wait it out. There are reports from people who've experienced maybe milder versions of this, that a warm or hot shower can help relieve some of the nausea. Obviously, with MS and potential heat sensitivity, we just want to be aware that there may be a trade-off if you get a super hot shower. So that is something to be aware of. One of the questions that comes up frequently with cannabinoids is cognition. Am I going to impair my cognition? And it probably is going to depend on two things: your individual metabolism and just the dose and products that you're actually using. We see individuals who seem to have a very high tolerance for different cannabinoid products, and other people seem to have a lower tolerance. There was an interesting study last year that took a group of individuals with MS who were using cannabis on a regular basis for whatever symptom they were using. Maybe it could have been pain, spasticity, bladder symptoms, but they were using it on a regular basis. And what this study did cognitive testing at baseline on all of these individuals. And then in one group, they had them abstain. They stopped completely. In the other group, they kept doing what they were doing. And at the end of a month, they repeated their cognitive testing. The group that stopped actually had mild but statistically significant improvements in their cognition in the month that they went off. The group that was continuing to use cannabis, their cognition stayed the same. So that's not a harsh indictment of cannabinoids. That's not to say you shouldn't use them because they're going to affect your cognition. It's just saying we need to be aware of it. I can show you probably the same thing with baclofen and tizanidine that we use for spasticity. And we know that those can be sedating for some people. And if we did a similar study in someone on a higher dose of baclofen or tizanidine, there's a decent chance we might see similar results with those prescription products. We are, so again, the areas that we're primarily looking at for symptom management with cannabinoids are going to be the spasticity, spasms, pain management, and bladder. There's an interesting sort of hypothesis that if CB2 receptors, where cannabinoids work in the immune system, are primarily anti-inflammatory, is it possible that cannabinoids could serve as disease-modifying therapies? Could they actually change the course of multiple sclerosis in the way that our FDA-approved disease-modifying therapies do? And it's an interesting idea, and lots of different groups are looking at it. Right now, as we're here today, no one's been able to prove that. It may be that we're setting the bar a little bit too high. A lot of the studies that have been done looking for a disease-modifying effect from cannabinoids in MS have looked at people with secondary and primary progressive MS. That's a tough bar to hurdle. In fairness, we don't have a lot of FDA-approved medications that alter the course of primary and secondary progressive MS. We have ocrelizumab in primary progressive MS. Some of our newer therapies work in secondary progressive MS with activity, but purely progressive forms of MS, none of our FDA-approved disease-modifying therapies have worked like gangbusters. So it may be that we are looking at the wrong group of individuals, and maybe we need to look at people with earlier forms of MS where there's still relapses to really see that treatment effect. But that, I would say, that's a stay tuned. Hopefully we will see something in the future. Interestingly, a lot of pharmaceutical companies, somewhere in their basement, they will have a division of research looking at cannabinoids for multiple sclerosis. So there is a lot of interest scientifically. We do have a phase 3 study in the United States going on right now with Sativex. If you've not heard of Sativex, it is a product from GW Pharmaceuticals in the UK. They have partnered with a company here in the US, Greenwich Pharmaceuticals, to look at getting FDA approval for Sativex for spasms and multiple sclerosis. It is a roughly 1-to-1 ratio mixture of CBD and THC, Delta 9 THC. in kind of a little Banaka blast sprayer. We know it works for spasms. It is approved in 23 other countries globally. It's been approved for probably 15 years now. We're just a little slow to the game in the United States. It's going to be and I do think it will get approval. It's going to be an interesting political and legal sort of dance that will occur, because the product contains THC, and THC is currently listed as a Schedule 1 drug by the FDA. It's going to require, I'm sorry, by the DEA. It's going to require that the DEA change that labeling. They've done it for CBD already. They'll need to do it for THC as well in order that this product would get FDA approval. I think the appeal to a product like this would be that it's going to be about as laboratory tested as you can get. It will have been highly studied, and insurance should cover the cost of it for you. I anticipate that it's going to be probably on the pricey side, so that there's always that downside to something going through all of these expensive clinical trials and getting an official FDA approval. That the markup's probably going to be pretty significant, but again, hopefully insurance would pick up the cost of that. Lastly, in the realm of FDA approved products that are out there, we do have dronabinol or Marinol. This is a synthetic THC. It is FDA approved for nausea in chemotherapy patients, sometimes used as an appetite stimulant for people with full-blown AIDS. We've pulled it out of the toolbox occasionally for managing various symptoms with MS. Insurance will typically cover it, even though it's off-label. So it's one more tool in the toolbox for managing things. With that, I'm going to turn it over to Aryn. So Aryn and I go back quite a few years, and Aryn has been just such a big help to the MS community that we work with. When Georgia, where I'm at, passed some of our THC laws, and said that individuals with MS could have 5% THC oil, we needed to talk to somebody out there who could serve as a resource. And it was actually a patient that introduced us to Aryn. And I needed someone that I trusted in referring our individuals with MS to. So Aryn has family here in Georgia, so we were able to meet face to face, and he's just been a great guy to work with. My wife and I do medical work in Nicaragua. Aryn has been down a couple of times to Nicaragua with us with the nonprofit that we work with. So yeah, be interested to hear what he has to say. And I know one question I have for him that I'm going to throw out to, I hope he will address, is, and we're getting lots of questions from our patients on, is this whole phenomenon of Delta 8 THC, which we're seeing sold pretty much everywhere. It seems like around the state of Georgia, and I'm sure Florida, same thing. But yeah, Aryn, would love to hear what you have to say.
All right. Well, first of all, I want to thank Chris for putting this thing together and the initiative to start it, and Casey and Deborah and everyone at the MS Foundation. Of course, Dr. Ben, I appreciate working with you, and I've learned so much about MS and have worked on so many different categories of wellness. There's just, the impact of MS is just, it's crazy, and I'm just glad to be a part of it. What I would like to first just maybe piggyback on some of the things that Ben was mentioning about how you can uptake and basically call it an overdose. When you have an experience that's just too much, you don't enjoy it, you want it to stop, your mind won't stop acting, thinking, maybe you do get the spins in the room and those kinds of things, that for all intents and purposes is an overdose. And so the way to mitigate that, and what we do at Canna Causes, is we offer cannabis therapy consultations. And with that, we go through the complete science of the plant itself, the science way that works in the body, much of what you've just heard Ben talk about. We go maybe into a little more detail in some areas, not as much in others, because we just want you to have a basic understanding of what works, what doesn't. And that's the process, right? There's 3 steps in the process. And number 1 is discovery. And in discovery, you just want to know what works, what doesn't. And the objective of all the patients that I work with, not just MS, and you'll have to excuse me, I have a little dog here, so she barks. I don't mean to break up the conversation. The glory of working at home. And so in any event, it's about taking the edge off without taking the edge off, and what I call the sweet spot. And as Ben was alluding to, the objective is not to be disoriented or lose cognitive ability or anything like that. In some cases, maybe we need to, depending on the severity of the episode that we're having. Maybe we just need a really big dose. But some of the ways that he also spoke into was taking too much. But there's also taking too much too fast, or even a little amount. So discovery is super important if you're new to it, even if you're not new to it. I come across a lot of people who've been around the plant as long as I have, and they know everything about it. You know, they've been partaking recreational forever, and there isn't anything you can tell them. I think I smoke some all day. Smoking may not be the modality that works for you. And so you need to explore some of these other modalities. And for some people, they don't smoke or vape is what I recommend at all. And they choose not to do that. That might be the only modality that does work. So you kind of have to keep an open mind. And with that is where we talk about microdosing. And my definition of microdosing, much like what we talk about in the medical community, Ben can attest to that, is that start low, go slow. But I add one little more step to that, and that's don't be afraid to go all the way. Because if you're titrating up and you're more and more and more and it doesn't work, some people tend to get frustrated. This stuff doesn't work. So you can be bold, titrate up more than what you might expect. If you take a little too much, okay, you might have a slight bit too much, but it's an experience. You'll get through it, and you'll know that my optimum dose is somewhere between here and here. So that's all I wanted to say on that subject about dosing and titrating and that. Delta 8. So there's a lot of things going on about Delta 8. I was invited last August to Denver to speak on a panel that focused on Delta 8. The conference was primarily Delta 8 and psychedelics, mushrooms. And I learned quite a bit there. I knew a bit about it, but I learned so much more because there were a lot of producers there of the product and how they were very bold about, oh, you know, we got all these sales and all this kind of stuff. And quite honestly, most of the industry, it's about that green rush mentality. And it's not about that at all. It's about helping people like you find that optimum product, that optimum dose, and find what can maybe be more of an adjunct. And that's the way we want to look at it in the beginning. And then maybe an alternative. So with this Delta 8, most people don't know the way that it's derived. Somebody had too much time on their hands, and they realized that with the chemical exchange of the CBD isolate, which I guess I'll break that down maybe a little bit of how isolate is made. So you have a full spectrum oil, you take the plant, we extract everything that's in the plant. That can be from the flower only, which is preferred, or you can take the whole plant. You get this full spectrum oil. From that oil, I can then heat it up. And by heating it, all the cannabinoids will separate at different temperatures. And THC is the first one to separate. And with that, some companies will skim that off the top, and now they have a broad spectrum. And the keywords there are THC free. And people love that. Why do they do that? Because they're playing on our fears. THC, but if you don't understand, like Ben said earlier about the endocannabinoid system and that CB1 receptor, if you're having any symptom that's related to spasticity, neuropathy, just anything neuropathic, I'm just gonna go ahead and say that it's not a question of do you need THC? The question becomes how much and what that ratio is. And if you're afraid of getting high or you're nervous about it, I won't say afraid, maybe just nervous, then you can supplement that with high doses of CBD, and you can actually neutralize that psychotropic effect to some degree, depending on how you metabolize, and a number of other factors that go into that. So With this Delta 8, what they do then, they take this broad spectrum and they make an isolate. And the isolate, generally speaking, is what's called CBD isolate. They make CBN, CBG, THC. There's all types of isolates that they isolate this one compound. And they do it by a chemical reaction. And generally speaking, many people are using a chemical like hydrochloric acid. If we know what that is, we put that in our swimming pools to kill algae. If you get it on your skin, it will eat your skin off. So what do? Just like when we're growing it, in the final weeks that we're growing, we go to harvest, there's a flush cycle. And what we want to do is flush to get all the salts and everything out of the root base and out of the flavoring if somebody's going to smoke it. We want to get all those nutrients or whatever's been put on or through the root system in the plant, and we do that. So they also flush these chemicals out, and they take and get a certificate of analysis, a COA. The thing about it is that with a COA, if anyone's ever seen one of these reports, for the layman, they're kind of difficult to understand. But if you look at the report, generally speaking, in any test, we have an LOQ, a lowest optimum quantity, meaning if my benchmark is 5 and it comes in at 4.99, I can say none detected or anything lower. If it comes in at 5 or higher, I put a number by that and it says, yes, it was detected and here's how much is in there. And people think, well, it's way over or it's not that much. The thing about it is you don't know, because none detected doesn't mean that there's nothing there. It just means there was nothing detected. So there was an article that I recently found, and we've got it on our website at cancercauses.org. And it was done by Chemist and Engineering Association. And they did it on the concerns of the chemists with regards to Delta 8 and how much they don't know about it. And when you're using chemicals like hydrochloric acid, you just want to know what you're putting in your body. And the other thing about it is, so I take this isolate, and because the market's been so inundated with growing in CBD, there's a glut in the market. And so they take this isolate and they make this Delta 8. It's super cheap. And so people that are on a budget are saying, well, I can get a cartridge, a vape cartridge for half the price. Well, of course you can, because of how cheap it is and the way that they're processing it. You can get gummies, you can get topicals, you can get all these things with the Delta 8. And all I would say on that is, and I'm happy to answer any other questions, but just be aware of what you're putting in or on your body. And with that, I think my 5 minutes have been exceeded. So I will, I guess, hand it off to Chris and go from there.
Yeah, I mean, I always kind of live by the motto, don't buy your medicine at a gas station. I think it's pretty good. I know in certain states and there's certain places in Florida, it's promoted as such. It's you can do this and that with it and enhance what you already have to stretch out what you already have. The good stuff, you can put some of this with it and it will help stretch it out a little bit more. So it's very interesting, but hydrochloric acid should only really be in swimming pools in your stomach, I believe, are the two places that they should be, not taking them in. So just a little background. I wrote this there in the MS Focus magazine. I wrote an article because I was interested in sharing intake and innovations for people who have spasms and things like this, because not everyone can hold a joint in their hand and light a lighter. And the different ways to intake cannabis is wide, and a lot of people, because it's been demonized for so long, are unaware of what is safe and effective. And to be medicine, it has to be both. It's not been, cannabis in many forms has not been tested the way other medicines have been tested. So some of the questions that come up is, and you mentioned earlier about how it makes people feel. And sometimes what I found is it depends on the day and how the person who is intaking the medicine feels. And not every day is the right day. And there's something called set and setting, in which the setting that you're in and how you feel makes a big difference when you take the medicine in? I just wanted to get your thoughts on that.
No, that's a very real thing. I'm glad you brought that up. And that's probably one of the biggest differences between, say, baclofen and tizanidine for spasticity, spasm management, and cannabinoids. And that my experience with baclofen and tizanidine over the years is we don't see that set and setting kind of phenomenon. You know, your response is your response typically. Maybe if you woke up one day and you're a little drowsy, you might be more susceptible to the drowsiness, but not to the same degree I think that we see with cannabinoids. So it's an interesting phenomenon. So it may have to do with where your brain is at on a given day, mood wise. It may help determine which receptors in which area of the brain are preferentially stimulated by a certain dose of THC. So yeah, I think we've only started to scratch the surface of that scientifically, but I think it reminds us that people need, as they're kind of finding what's right for them, as they're microdosing, like Aryn was saying, kind of maybe keep just a journal of, okay, I took this dose this day, this is the mood I was in, this is where I was at, and see if that's a factor for an individual.
And because I've noted, like, it's one thing to go to your doctor's office, your doctor has, here, take this, smoke this here, it's in a safe space, as opposed to being in your backyard, or being in a house with kids, or being in a certain space.
Mm-hmm.
So with that, when is not a good time to partake? I would suggest not taking it and then driving right away.
Yeah, I think it's that. So just like any medication that could potentially alter your cognition, alter your energy levels, it could be sedating for you. I think you want to be cautious about using it before you're like the medications always say, before you operate heavy equipment. So just be cautious of putting yourself in any setting where you could put yourself or someone else in danger. And I think especially when you're in that titration phase, when you haven't quite figured out what dose and what products are going to be most appropriate for you, just be cautious about that. Be aware also of, and this is not so much a safety issue, but more of just a legal vocational issue. Be aware of what your state laws and what your vocational issues are. Like in Georgia, even though our Georgia law says you can possess, THC oil, the law also said that your employer doesn't have to honor that. So if my employer has a zero tolerance policy and I have a drug screen and I show up with THC, it doesn't matter that the Georgia law says I can have it. That employer could still act on that and do whatever they want. So it's just some people just need to know what their state laws are.
So
can I add on to that a little bit, Chris?
Yes, sure, please.
Yeah. Well, you mentioned about when's a time not to do it. This is, I guess want to kind of lean into the discovery part of it, because if you're going to try this, the time to try it is not when you're having a really bad episode, right? You want to kind of lean into it slow before you're having these types of experiences, because when you're doing something, you're in a lot of pain or whatever, and you're trying to do it, you don't know how much to do and what works, what doesn't, and then you start taking maybe too much. So that might be an opportunity of not doing it at that time, and maybe going to your normal medications, but which you should be doing anyway. But you just kind of triggered that thought of me, Chris, when you
Sure.
asked that question.
Sure, and to kind of actually to kind of piggyback on that, like, let's say someone takes an SSRI or some sort of like effexor or things like that. Have there been any studies done on how they interact?
So there are websites where you can go and look for drug interactions. So and I think, again, because if we want to treat cannabis as medication, we have to realize that medications can have interactions with one another. So there are websites you can go to that will look at potential interactions. So a lot of times what it has to do with one medication maybe enhancing or decreasing the metabolism of another medication. So yeah, I would encourage people, talk to your healthcare provider, go to some of these websites. I have pharmacology friends that are comfortable having those discussions with people as well. So there are a lot of different resources to look for that information. Along those same lines, I'm I'm a simple person. When I'm adding a medication, whether it's cannabis or anything else, I like to only change one variable at a time. So let's say that you're on Baclofen for your spasticity and spasms, and it's not quite cutting it, and we're going to add cannabinoids to that. I would prefer to keep your Baclofen dose the same. I would prefer to start microdosing with the cannabinoids, see what effect we get, and then if we start having success, then start titrating down on the Baclofen or whatever other antispasmodic. I think if we're trying to titrate up on one and titrate down on another at the same time, it just adds a level of potential confusion to the situation.
Right. One of the ways that we address that, Ben, is with patients is, again, back to the process. So step one being discovery, step two is consistency. And you want to get consistency anytime you're using anything. And like Ben said, don't change anything, because it's really hard to tell what's working, what's not, if you do. The other thing is if you take the cannabinoids after you take your medication, maybe that's the safe place to start, so you know you're getting effect. But then it's also hard to tell how well the cannabinoids are working. So you might entertain taking it before you take the medication as well, and keeping that ledger to see, is it working a little bit better? Because if the Baclofen is already taking some of the edge off, well, the cannabis might already take that edge down to that point. And then, like you said, get into that medication management before you start taking any medication off. And the last thing is make sure you tell your doctor that you want to entertain that. Don't just do it.
And make sure you tell your medical doctor, because they're not just, and your neurologist and all the people involved, not just the guy who you go get the script from.
Yeah.
There's a big difference in who knows what. Very important.
I would say, to piggyback on that, if you're working with a pain management specialist, be sure you get clearance from them before you start any kind of THC containing product. Because if you're on any sort of opioid painkillers through a pain management clinic, a lot of times you've got a contract with that pain clinic, and they may be doing random drug screens. And I've seen this come up where all of a sudden THC shows up, and you're using it from a medical standpoint, but then this pain clinic has a zero tolerance policy, and the next thing you know, they're not wanting to treat you anymore. So just make sure everyone's on the same page.
Yeah.
One more comment, Chris.
Sure.
About the when something's working or not. And I did see a question in there. Someone asked about one of their friends is using cannabis or cannabinoids, and it's not working, and they don't even get high. So one of the things that we found, and Ben, maybe you could speak into this a little bit too, is about the P54 450 receptor, right? Where if doctor warned you about drinking grapefruit juice before taking medications, it's blocking those receptors, inhibiting them from being able to uptake or function, get the result that we're looking for. CBD can be the same way for some of those people. So just something else to think about. If you've been warned about that, that might be something that's going on in that.
Yeah.
way.
And so, you had mentioned, Aryn, that, you can use CBD to help blunt some of the potential high from cannabis. And it may be that too much CBD could, in the right individual, could blunt everything. So yeah, CBD is an interesting compound, because a lot of what it does is just inhibit the breakdown of some of the other cannabinoids. So I think we're still learning a lot about CBD effects itself. So yeah.
So one of the things you mentioned, pineapple. One of the my understanding from friends of mine is that mango can give an enhanced effect if you intake THC. I didn't know if you're familiar with this or not. It has something to do with, I'm not 100% sure, but it's one of those myths that I'm not sure has been fleshed out 100%.
Aryn, I'm going to punt that one to you. I'm not aware of that one.
And we're in Florida, so we have a lot of mangoes. So
yeah,
right.
I mean, because there's certain foods that can have an effect when like with other medicines, and mango was one that I was told might have that similar effect. So I wasn't sure if you're aware or able to expand on that.
I can't speak to it with absolute certain, But one thing we do know is that from mango comes the terpene myrcene. And that, like some of the other terpenes, have different effects on us. And so it's believed that maybe the myrcene may have a better ability to kind of, like when they speak about nano or water soluble, a better or faster uptake. So yes, I've heard some of those rumors. I've not seen any studies on it,
Okay.
but you know, cannabis, that's one of the terpenes definitely in cannabis. And when you combine these different terpenes together, that's what determines what a strain is. Then, you know, again, you might do, you might be in the indica realm and that's your favorite, but you could find that 2 out of the 5 indicas that you try have good results on you, and the other ones are just to give you a headache or do something adverse to you. So again, why discovery is really important, and to find something that works for you. And it's just crazy that it can be so different. You can have so many different effects of what works, what doesn't.
Sure. And
with that.
And speaking of diet, sometimes people will get munchies. From a health perspective, what would you suggest making a plan before you begin to intake cannabis to make sure that you're not just raiding the fridge, you know, like a college kid?
Yeah, I think if you know that you know, whatever you're using from a cannabis standpoint has the potential to give you the munchies, I think, like you say, have a plan ahead of time, have some healthy snacks out, and maybe put things that are not great food alternatives, you know, hide them or don't have them in the house at all. It's yeah. So just have know it's going to happen and have a plan. I thought it was funny, you know, as dispensaries started opening up around the country, that, you know, when the Girl Scouts were doing their Girl Scout cookies, sometimes set up outside of dispensaries. That's brilliant.
Yeah,
so,
yeah. Awesome.
Don't fall prey to the Girl Scout cookies.
So switching to actual intake real quick, and then we'll get to some questions. For intake, let's say for people who want to use whether it's pre-roll joints or cannabis or vape oil or vaping flower, if there is a difference, not necessarily in how it makes you feel, but just in like lung health, or irritation, because some people, if they start coughing, they have a tough time stopping. If there is a distinction between using a lighter with butane versus an electric lighter versus a vaporizer for flower versus a vaporizer for oil. I know that's a lot of ground, but if you guys might speak on that for a moment.
I mean, my experience has been the lower the temperature that you can have, that so that you don't have these, you know, superheated, you know, gases going into your upper airway, and your lower airways is probably going to be less irritating, you know, maybe smaller you know, puffs at a time, so you're not getting this massive blast. Can be a little bit less irritating for individuals. I think, and Aryn may speak on this as well, you want to make sure that you know what you're putting in your body. Obviously, if it's plant material and you know, you can see the, you know, that certification, you know what's in it, that's, to me, would probably be preferable than say an oil coming from the gas station, where you don't know if there are additives and things that are not going to be healthy for you. But, you know, I think working through reputable sources, hopefully you would, you know, be able to have some degree of reassurance that you know what's in that product that you're putting into your lungs. Most of the studies have not found, you know, a significant cancer risk with inhaled cannabis, as opposed to, say, cigarettes or, you know, other forms of tobacco. So I think if you're prone to reactive airways disease like asthma, just be aware of it. Again, if it irritates your lungs, you get a coughing spell, we might need to look at other routes of administration.
And I would agree with that. Definitely taking a puff. In fact, when people start vaping or smoking, we recommend just start with a puff, literally, and then wait 5 minutes, because cannabis can also have a tendency to sneak up on us, right, on having that effect. So that'll save us from having that experience that we don't want to have. And I would also say that when smoking or vaping, I mean, it's kind of a preference. I'm obviously old school. I don't smoke a lot of flower anymore. I only would do it if it's really, really good quality. And that's why I kind of am kindly referred to as a cannabis snob, because it doesn't look good, taste good, or make me feel good. Like, why would you do it? But some people, again, it comes down to economics, and some people just don't have the money to get something kind of good quality like that. But when you do find a source, then you really want to kind of stick with it, because at that point, consistency is the name of the game in terms of what products that you get. You're not constantly, like you say, buying it from a gas station or whatever. We don't know what's in it. And not that there's a lot of bad products out there. It's just, you just want to find a reliable source.
I think to piggyback on that, when we think about route of administration too, I mean, from coming from the strictly the medical standpoint, I would say that, yeah, to me, doing something by mouth pharmacologically is kind of fits the bill for what I'm trying to accomplish in symptom management. If I'm trying to get long-term pain management, long-term spasticity, or spasm management, you know, if I give someone something by mouth, I have a kind of a lower, what we call Cmax, the maximum concentration, and I have a longer area under the curve, so I get this nice smoother response, maybe a longer duration of action. Whereas if I do something by an inhaled route, I have a higher Cmax. It goes up faster and higher. Maybe if you're having an acute event, you know, you're miserable right at this moment with pain or spasticity, you might want that higher Cmax and a faster onset of action. But I think for long-term use, I mean, in general, I would prefer something that's going to stick around a little bit longer, allow you to do less frequent dosing, and have just kind of a smoother response. But again, that's just a general guideline.
And that's right on point, Ben. And just, there's two questions on here that the same person asked about how does vaping affect our throats, and the difference between vaping and edibles, and what's the delay in the onset. And anytime we inhale anything, right, it's straight to the lung lining and to the brain. So what are there but our receptors? So with smoking or vaping, you get kind of that immediate relief. And to Ben's point, sometimes, like I tell people with sleep, I have trouble getting to sleep. So I tell them, then maybe a hit of an indica, something to help relax you, because indicas bring us down and help us relax. Again, just a puff. And then do a tincture, sublingual, do an edible, because when we eat something, that delay is, it's got to go through the filtration system, right? The stomach, whatever we ate, the kidney, the liver, and then into our system. And sometimes that can take 30 minutes to 2 hours for some people to have an effect. And that's where most people get in trouble when they overdose, because they take a edible or something and they're like, wow, an hour later, this stuff doesn't work. And they take another piece, and another hour later, it still doesn't work. And it's like, be patient. And then they want to try a little more. And then all of a sudden it hits them, and you're in serious trouble at that point. So again, discovery, be patient, and you'll get it figured out. It's just your body going to metabolizing, but also then to the medications that you're taking. So the medications that you're taking can also maybe not give you that full-on effect. Or if I'm titrating down, I'm trying to reduce the medication, I then have an episode and I'm trying to reduce it. Well, we don't bring that back into our regimen. What we want to do is maybe increase the dose that we're taking, or maybe it's the potency and the ratio of what we need to take, or both. And that's why working with someone that can coach you is really helpful, because we don't know what to kind of do in these situations. It's not, it didn't stop working. It's just your body is changing, and you just need to kind of understand what those changes are, and work with it.
All right. So we've been answering the questions that are in the Q&A. I just want to let folks know, if you do have a question, please enter it in the Q&A, because we can see that live, and we can answer it and knock them down as we go. And we've been doing pretty well with that. And we do have one in here from Karen, who says she uses sublingual under her tongue and has issues with diarrhea. Any suggestions? Gummies are better. Main issue is joint pain and spasticity.
So she's getting diarrhea from the cannabis, the sublingual cannabis.
That's what my understanding is.
Yeah, it may be then, so what Aryn has to say, it may be that she's getting too much too fast, either too much too fast, or both by doing the sublingual. I wonder if sticking to more of an edible is going to give her again a lower Cmax. So we use two terms, Tmax and Cmax. Cmax is the peak concentration, how much have you got in your system. Tmax is how long it takes to get there. So she may be getting too much too fast, and if she stayed away from the sublingual and just maybe did the edible, maybe that's going to give her a little smoother response and less of a GI effect.
Okay.
I would also say there's the possibility of what the carrier oil is that is in there. So we use an MCT coconut. That's what I recommend in all the formulations that I create, in part because coconut oil is really good for the body, but a lot of people use, well, some people use hemp seed oil. A lot of people use olive oil, and they like the taste is horrific. So that could be also contributing to that.
Point.
Okay. It is, looks like it's 4:20 here on the East Coast, so we have about 10 minutes left. And for those who know,
Break time for you, Chris?
yeah, it's very good, very good. So we do have a question that's been in here for a while from Robert. That's what is a high dose of baclofen? Just so we can.
Yeah, so that same rule that Aryn discussed about the microdosing, go low, go slow, applies to baclofen tizanidine. So we're going to start with a low dose, somewhere between 5 and 10 milligrams, 3 times a day, and go upwards. You're going to go up on that dose until one of 3 things happens. Either you're satisfied, you're happy, you're sleepy, or you're floppy. Which sometimes call them the 3 dwarves of baclofen, happy, sleepy, and floppy. We want happy. We would rather the other 2 not visit. The official FDA maximal dose of baclofen is about 90 milligrams per day. So that would be an official high dose. In reality, there are people who take more baclofen than that. It's really whatever you need and tolerate. So in more severe spasticity and spasms, we have individuals who are on 120 milligrams a day. One of the big take-home precautions on those bigger doses of baclofen is you never ever want to stop that abruptly. That's a big no-no. There is seizure risk if you stop a baclofen abruptly. I even tell people, if you're taking 10 milligrams 3 times a day, you're probably going to get away with stopping that abruptly, but let's not push our luck. So any regular dose of baclofen, we probably should titrate you off of it, just like we titrated you onto it.
Okay. And part of that is, does the same thing happen with cannabis? If you just stop taking it all of a sudden, are there any bad effects, ill effects?
I mean, there's no seizure risk for sure. I mean, so Aryn thinks, you might have a psychological effect where if you have, say, what if you're managing some anxiety with cannabis, you could have a rebound of your anxiety, but I don't know of any medically serious complication to abruptly withdrawing from cannabinoids.
Right. And that's very true on that with the anxiety, but it also could then maybe stimulate a little of anxiety. But think about it. I eat chocolate like crazy, or ice cream, or I go on a diet. You start craving a carb or something. And until you can get that into your body, you just do. And if you can't get it, or whatever the reason is, you get a little bit anxious. So it's no different. It's mind over matter at that point. And you just got to kind of know that you just don't need it all the time. And in fact, part of our dosing instructions that we give to people is that we tell them, listen, if you're taking it and you're in the consistent mode, step 2, and you're taking a medication, and let's say for 2 weeks I've had a good run, I've been feeling better than ever, then don't take it the next day. See what happens. If you feel good through that day, then maybe don't take the cannabis again, and just see how long you can kind of stretch that out before you feel like you kind of need it again. It does 2 things. One is it tells you that you don't need to do it every day. And 2, we want to coach people. We're not looking to replace a bunch of this with a bunch of that, right? We want to take and use it as needed, but that's about listening to your body and understanding that. So Not doing it is a really good thing. And then it also helps with tolerance issues, as does using a different modality. Don't get stuck on the same modality day in and day out every day, because your tolerances will go through the roof like it will with anything else, eating, baclofen, gabapentin, any of those.
Can you explain, this is from Jennifer, explain more about how it might help bladder issues?
So the bladder is just a big muscle. It's the detrusor muscle is just a big muscular bag that stores urine, and when you want to go, it's gonna squeeze. So in MS, one of the more common issues we see is a small overactive bladder. It's filling up and wanting to go right now. So it's very overactive. And what studies have shown is that CBD, THC products can actually help that relax. Cannabinoids probably don't work as well for the other bladder issue we see, and that's a large underactive bladder. So these are individuals who don't empty their bladder very well. They're going to be doing, intermittent self-catheterization, things like that. That the cannabinoids are probably not quite as effective for that bladder problem.
All right, and a couple more minutes here. So I want to, because there are a lot of bladder questions, but I think you answered a majority of them in that bit right there. Michelle has an interesting question. She has a trick finding, what's a trick to finding the right person to assist? She's in Colorado and disappointed with their knowledge in regarding medical issues, and the best questions to ask. And I might say, like, if you go to to California or Colorado or a place that they have dispensaries, their job is to sell weed to you. So I would not go there asking personally for medical advice. Make sure that you go to someone first and then give specifics about that, but leading into that. But go ahead, and if you have any suggestions for that.
I would say in the medical community, you're going to find a really wide array of knowledge bases amongst different healthcare providers, and that's a tough one. You're going to find individuals in the medical community who are completely uncomfortable having this discussion. You're going to have individuals who are really comfortable and pretty knowledgeable. So I wish that there was a set answer. A lot of times, it's just word of mouth or your MS support groups. There's a ton of information online. I mean, there's so much stuff out there, and Aryn might be able to speak to any good websites just for medical information. But I know there's a lot of stuff out there. There are on e-journals, paper journals that talk about the latest in cannabis medical research.
Well, I think I can't really speak into what other people do, and where the medical there's that fine line there. I'm clearly not a medical doctor, but my best friend, Dr. Ben, is, so I defer to him quite a bit. But here's what I would say and why we do the work the way that we do it. And so that's all I can speak into. In the process, you fill out an intake. And that intake asks, do you have spasticity? What medication do you take? How much? How often? How effective? And it goes through a litany of these things, because in a dispensary, they don't have the time for that. I've been in so many dispensaries, and they're not interested in that. And like Chris said, they just want to sell you a product. And generally speaking, they want to sell you the product that they're making the most money on. They don't care about anything much else than that. But going through and having these questions, just like when you go to a new doctor, you fill out a medical questionnaire. And again, me not being a doctor, what I can tell you is that after treating over 2,000 patients and consulting them, I've got a database that is pretty healthy, pretty robust, and I've categorized different people. So I can kind of give you a baseline of where to start, and then we interact with your physician. If it's a physician that chooses, like Dr. Ben, that we'll work together and we'll talk about it. If we have a problem patient, or if I'm experiencing something from one of his patients, I'll call him up and say, Ben, the patient's experiencing this. We just had one the other day that it doesn't work for spasticity, and it was working and it doesn't work anymore. And he's taking some pretty high doses of it. And I kept telling him, well, when's the last time you had a scan? And he said, well, it's been a couple of years. And his Dr. Ben's his doctor. And I said, well, maybe you want to ask Ben about that. Well, I had it 2 years ago. I don't know. I can't answer that question, but what I can tell you is that something isn't, if it worked and it's not working, something has changed.
Mhm.
And what we want to do is identify what that is. And I don't know, Ben, is that kind of a
No,
good-
that, or even something, metabolically, urinary tract infections. One of the bigger drivers of spasticity and spasms where the person's doing fine and now they're not doing fine, it's just even a very low level UTI will drive spasticity nuts.
Mm.
Mhm. So we have a bunch more questions and only a couple of minutes really left. So there is a question here that I see at the very bottom. It was one of the last ones asked, and I think it's very valid, which is, do I still need to be afraid to tell doctors about, I presume, cannabis use because of insurance?
I've not seen any insurance issues come up with cannabis. I mean, generally your insurance carrier is not going to care one way or the other. You could say, if you're being cynical, they'd probably be thrilled if you use less prescription drugs because that's less money that they're spending. So I've never seen any issues come up with a health insurer. Again, my big concern is more the pain management folks, just to make sure that they're on board and they know you're doing that, and that they're not going to freak out if they see a positive THC on a urine drug screen.
Yeah, and every state is different, so we have to be mindful of that. Depending on what state you go to, some you can grow it in, some you can't, some you can buy it in, some you can't, some it's adult use and medical. But the bottom line for a lot of businesses is, even though it might be legal, it might not be okay with their company. So it might be more job related than it is insurance related at this point, which could affect your insurance if they find out. Anna has a question about, she sometimes gets headaches when she uses cannabis. Any thoughts on how to prevent that? I suggest hydrate a fair bit. That can, because you can get dehydrated and such, but
maybe hydration, and then just look at maybe route of administration. I wonder if it's more likely that it happens with her with an inhaled versus an oral, and does that have to do maybe with that peak concentration that she's hitting?
okay. And then, there are a bunch more questions. I don't know if you have, how much time you guys have available. If we have 5 more minutes.
I unfortunately don't. I've got a patient upstairs that is sometimes, and they're texting me on as we speak.
Okay.
So I'm
Okay,
going to have to jump off here. I apologize.
No worries. We'll finish up then. Aryn, I wanted to hand the table to you. Yeah.
I could stand a little longer and only answer questions, obviously, that I can answer, but absolutely, I'm happy to stay a few extra minutes here.
Yeah,
Absolutely.
okay. I think that works. So we can get through a couple more. Some of these are medical, but we can answer some basic stuff, I think.
Yeah.
If that's okay.
Chris, thank you guys very much. I appreciate it. We can always do another one of these, and even just do a pure Q&A if you guys want to, just to get through more questions.
Okay. All right.
Yeah.
Well, thank you, Dr.
Everybody
Ben.
stay safe, and look forward to doing this again.
All right. Thank you, Dr. Ben.
All right.
All right. We're just going to take a couple more. I'm just going to look through the questions real quick, because there's certain ones.
While you're doing that, let me also just speak into why you're looking for a question, Chris. So for anyone out there that's getting a medical card, one of the things in Georgia, I don't know in Florida, but generally speaking, when they issue a medical card, they're not a photo ID medical card. So I always encourage everyone, take your medical card and your driver's license and photocopy them back to back and laminate it. Put one in your glove box, put one on your person, your wallet, your purse, whatever. And if you travel, put one in your travel bag, so that if you happen to have medicine on you and you get pulled over, you've got your medical card. And if you only have your medical card, you don't have an ID, you don't have to explain anything. They can see it's clearly you, and you've got that. Because a lot of people are afraid to maybe drive with it in the car. Not that you should take it and do it, but if you're a passenger and whatever, just a safety, something to consider.
We'll also consider, if you are a passenger, that there is something known as hot boxing, that you have to be careful of other people in the room or in the space that you're in. If you're in a car and you smoke cannabis, it can affect the driver and the other passengers, as well as children. And also making sure that you store your medicine safely, because if dogs eat it, they have really bad reactions to it. and children as well. We don't want that, especially for edibles. That can be pretty dangerous. So a majority of what I see here are kind of medical questions. There is a question if there is a link to the site that you spoke of. I believe it's Cannacauses Foundation.
Well, it's cannacausesplural.org.
Okay.
CANNACAUSES.org.
Yeah, and this is your foundation, and you mentioned that you wanted there was something you were going to do special for people with MS.
Yeah. So for anyone that's still on the call, or even if you were on the call earlier, what I'd like to do is just extend some gratitude to you as well. Again, we charge $100 for a consultation, and what we're going to do is if you use a code MSF, that's Mary Saul Frank 5050. We're going to donate half of that consultation fee to the MS Foundation through the end of the month, just whoever decides to come on. You'll find that it's very much worth it. We'll have you take notes, and then we can give you product recommendations, look at you specifically, you fill out the intake form and do all that. But if you have any interest in that, we'd be happy to hear from you and help coach you through the process to figure out what's going to work and what's not.
And you, just to kind of finish up, you have been a huge help and supporter to not just people with MS, but people with all kinds of ailments. And we really appreciate you because there's not been a lot of research that was been done over the past 70 years, 80 years. And there are people who have needed this medicine for a very, very, very long time. And you have taken a lot of risk, I have to say, in order to do that. And so that's very appreciative. We appreciate that because the medicine of this, cannabis medicine and plant medicine in general has been disregarded for a very long time. And so bringing that to the forefront is huge, and we appreciate that. I do want to mention that we do have an article that's written in our MS Focus magazine, which will be out. It'll be available online on March 15th, around that time, and also should be in your mailboxes any day. And Aryn is featured in it, and so is Dr. Ben Thrower. And we go a little bit more in depth on different areas of intake. And the main thing is be safe with what you do. Don't overdo it, I think, is kind of the main message. Understanding what dosing is about, that 5 milligrams of an edible is different than 5 milligrams of a vape or a joint. And how what you eat, what's in your body can affect how you feel when you take the medicine. And treat it as such, treat it as medicine. Don't share your medicine with others. It's meant for you to work with spasticity and other and bladder issues and things like that. So just cautioning folks as we do to be safe, and talk to your doctors about it, and tell the positive stories, how it's helped you as well, so it can help others, because there is a lot of fear when it comes to cannabis use, fear and misunderstanding and misrepresentation. So please make sure that that you do that. And also remember, it's not for everyone. Just like Baclofen isn't for everyone, cannabis is not for everyone necessarily either. And that there's still a lot of work to be done and research to be done, and be safe with it. So that's, yeah. Any final thoughts, Aryn?
Yeah, if I could just share one more thing. So I just wanted to let everybody know too, is that like we work, MS is our biggest category, our biggest sector that we work in. In fact, we created a poster based on 100 patients. Back in 2019, we put this data together, and we created a poster that was published in the International Journal of MS Care in 2020. But that also being said, is that people suffer from a lot of other things as well. And then when you compound it with MS, it can be really bad. So I just wanted to say that we've got a lot of experience in a lot of areas. And so if you have questions or something afterwards, or you know somebody that is suffering maybe from something else or whatever, go to the website. There's a lot of information on there. There's stuff about research. And if you want to take a deeper dive individually, you on your own situation, we would just love to support you with whatever condition that is. And thanks again, Chris. I really appreciate you putting this together for us.
Yeah, and the www.cannacauses.org is the website you can look for more information as well. So that's going to be bring it to a close for today. If you missed any part of this conference, it has been recorded and will be available through our MS Focus Facebook and YouTube channels, and also on SoundCloud. So if you reply to your registration email for information on how to access recordings or sign up for a newsletter to learn about more upcoming events. Our next teleconference is going to be March 15th at 4 p.m. Eastern with Deborah Backus about participating with clinical trials. And so thank you guys so much for coming. Oh, there was one thing I wanted to mention and I forget. Of course, but I do want to thank everyone. Oh, yes, there will be a survey that pops up right after you leave the conference. So please make sure you fill out the survey because it lets us know what we're doing right and what we're doing wrong, what we can do better. And it really helps us for future talks as well. So thank you guys, everyone, for showing up and being here and participating, and to Dr. Thrower and to Aryn, for your insight and knowledge and courage, and we appreciate that and appreciate everyone's time. Stay safe, everyone, and stay informed, most importantly, and have a great rest of the day. Thank you, guys.
Thanks, Chris. Appreciate it.